Clearly what has to happen is the Minister must instruct the HSE to ensure that there's no obstructions put in place to the publication of the HIQA report into the deaths of 5 babies in Portlaoise. The Minister claims that he's in charge of the health service, that he's ultimately responsible. Now it's time for him to act, not to be prevaricating, to instruct the HSE to allow the publication of the report. So we can have a timely debate on it, but more importantly we have to be conscious of the fact that 5 families are awaiting the publication of this report as well.
Biddy, is it not a case that maybe they shouldn't rush into this, that if there are flaws with the report, it would be better to fix those rather than cause issues down the road with people feeling they didn't get a fair hearing? And
well, one person's interpretation of a flaw may be incompetence by an interpretation of another person. Clearly, HIQA are charged with the responsibility of overseeing proper governance and clinical outcomes in the health services. They're charged with that investigation, and they should go about it unhindered and without threats of injunctions or anything else from another agency which is charged with delivery of safe healthcare in this country.
Is there something to be said that it is in fact actually healthy for a healthcare provider and the healthcare regulator to have some degree of tension? Because you wouldn't want them to be simply waving everything that they're doing through. That there has to be some degree of rigour, the relationship.
Yes, and that would have been taking place during the actual investigation itself carried out by HIQA. They would have gone in, they would have assessed the situation that they found in Portlaoise. They would have interviewed people, they would have had broad discussions about the delivery of healthcare in Portlaoise, and they would come to a conclusion, and that would be contained in the draft report, which should be published. And the idea that we now have a situation where the HSE is threatening to injunct the publication of that report pending the dilution of it or the diminution of the outcomes simply is unacceptable. And it's the Minister who we think at this stage has to step in, has to take ownership of the health services in this country, has to act with responsibility and instruct that this will be published so that we can find out what went wrong and make sure it doesn't happen again.